DNI do not intubate. DNR do not resuscitate. DNAR do not attempt resuscitation. DOA dead on arrival. Drugs of abuse. DOB date of birth. DO dyspnea on exertion. DOS docusate sodium. DP dorsalis pedis. DPH diphenylhydantoin. DPL diagnostic peritoneal lavage. DRT dead right there. DS or DZ disease. DS Down syndrome. DSA digital subtraction angiography. DSD dry sterile dressing. DSG dressing. DT diphtheria tetanus. Delirium tremens. DTA descending thoracic aorta. DTAP diphtheria tetanus acellular pertussis. DTP diphtheria tetanus pertussis. DTR deep tendon reflex. DT's delirium tremens. Duodenal ulcer. DUB dysfunctional uterine bleeding. DVT deep vein thrombosis. EAC external acoustic meatus. EACA epsilon aminocaproic acid. EBL estimated blood loss. EBM evidence-based medicine. Expressed breast milk. EBT electron beam tomography. EBV Epstein-Barr virus. EC enteric coating. ECF extracellular fluid. ECG electrocardiogram. ECM extracellular matrix. Echo-enteric cytopathic human orphan virus. ECLS extracorporeal life support. ECMO extracorporeal membrane oxygenation. ECP emergency care practitioner. ECT electroconvulsive therapy. ED emergency department. Erectile dysfunction. Ectodermal dysplasia. EDC estimated date of confinement. ED estimated date of delivery. Expected date of delivery. Estimated date of discharge. ED epidural hematoma. EDM esophageal Doppler monitor. EDDA ethylene diamine tetrasic acid. EDVN diastolic volume. EEE Eastern equine encephalitis. EEG electroencephalogram. EENT ears, eyes, nose, throat. EEX electrodiagnosis. F ejection fraction. EFM electronic fetal monitoring. EGBUS external genitalia, Bartholin's glands, urethra and Skene's glands. EGD esophagogastroduodenoscopy. EGF epidermal growth factor. EHEC enterohemorrhagic Escherichia coli. EIEC enteroinvasive Escherichia coli. EJ elbow jerk, triceps reflex. EKG electrocardiogram. ELSC selective lower segment caesarean section. ELISA enzyme linked immunosorbent assay. MBX endometrial biopsy. EMC encephalomyocarditis. EMD early morning discovery. EMF endomyocardial fibrosis. EMG electromyography. ELSC's emergency lower segment caesarean section. EMU early morning urine sample, pregnancy test. EMAL emulsion. EOM extraocular muscles. EOMI extraocular movements intact. EPEC enteropathogenic Escherichia coli. F edema proteinuria hypertension. EPO erythropoietin. EPS electrophysiology. ER emergency room. ERCP endoscopic retrograde cholangiopancreatography. ESL extracorporeal shockwave lithotripsy. ESBL extended spectrum beta-lactamase. ESR erythrocyte sedimentation rate. ESRD end-stage renal disease. ESVN systolic volume. ESWL extracorporeal shockwave lithotripsy. ET endothelin. Endotracheal. ETEC enterotoxigenic Escherichia coli. Etiology. ETOH ethanol, ethyl alcohol. ETS endoscopic thoracic sympathectomy. ETT endotracheal tube. EUA examination under anesthesia. EUP extrauterine pregnancy. EUS endoscopic ultrasonography. EVAR endovascular aneurysm repair. EVF erythrocyte volume fraction. Examination. EXP lap exploratory laparotomy. EXT extremities. FX fracture. FAM familial atypical multiple mole melanoma. FAP familial adenomatous polyposis. Fast focused assessment with sonography for trauma. FB foreign body. FBC full blood count. FBE full blood exam. FBG fasting blood glucose. FBS fasting blood sugar. F/C fevers and/or chills. FDC follicular dendritic cells. FDIU fetal demise in utero. FDP fibrin degradation product. FEV1 forced expiratory volume in 1 second. FE iron. Female. Femoral. FEP free erythrocyte protoporphyrin. FF free fluids, non-thickened fluids. FFA free fatty acids. FFP fresh frozen plasma. FHR fetal heart rate. FHS fetal heart sound. FHT fetal heart tones. FHX family history. FIBD found in bed dead. Fish fluorescence in situ hybridization. FLK funny looking kid. Fluid ounce. FMF fetal movements felt. FMP first menstrual period. fMRI functional magnetic resonance imaging. FN finger to nose test. FNA fine needle aspiration. FNAB fine needle aspiration biopsy. FNAC fine needle aspiration cytology. FNC full nursing care. FNH focal nodular hyperplasia. FOBT fecal occult blood test. FOF found on floor, patient fell out of bed. FOS full of stool. FPG fasting plasma glucose. From full range of motion. FSBS fingerstick blood sugar. FSE fetal scalp electrode. FSGS focal and segmental glomerulosclerosis. FSH follicle stimulating hormone. FTAABS fluorescent treponemal antibody absorption. FTT failure to thrive. F/U follow-up. FUO fever of unknown origin. FVC forced vital capacity. FWB full weight bearing.